Good morning, everybody. My name is Abigail Hirshman. I'm Head of Mental Health and Wellbeing for Acas. So what I'm going to do today is just run through some points and some guidance on managing mental health in the current climate. I've put some links on the slide, so please reference them afterwards. There is quite a lot of content, so I'll be touching on it rather than going through everything in detail. But there's lots of information for you to look at, and you're welcome to contact me afterwards. My details are on this slide, so please get in touch if you'd like to have any more information or discuss anything in more detail. So just to start off, this is Acas's position in terms of mental health at work prior to the pandemic and absolutely during the pandemic. What we recognise is that in order to really manage mental health at work from an individual and organisational perspective, we need to have three key players. So the employers need to be responsible, the managers need to have responsibility, and individuals need responsibility. Again, there's a link on this if you want to find out more information, but it really is important that everybody works together, because that is going to have the greatest impact on how we get through this time and how we continue to run a functional, sustainable workforce. So what I just want to touch on is what we know already. This was the latest guidance that came out just before we went into the lockdown situation by the What Works Wellbeing Centre, and it focuses on 5 key factors that impact on both wellbeing and productivity. The ones in purple are the preventative mechanisms, and the ones in grey are the responsive, reactive measures. And I think if we look at this now through the current lens, we can see that maybe our help for struggling workers and our health and wellbeing programmes need to be brought front and centre, because it's so important to recognise the issues that our staff face so that we can keep them working well, so that when we are back up to speed or trying to get back up to speed, we have a workforce that can function. The other things that I think have changed during this pandemic, so where the lens has shifted, is the impact on social relationships. So the fact that we are self-isolating or that we are separate from our normal family and social groups means that the work connections that we can establish are absolutely vital in helping people to feel connected. Connectivity, from a technical perspective and from a personal perspective, is a key determinant for how well we feel. So anything that organisations can do in terms of maintaining connection between staff, encouraging it, taking away those normal social constraints, is absolutely essential. So these are some of the issues that have come up that I've recognised in discussions with employers and seen amongst my own staff. So I'm just going to quickly touch on some of these. So if you look at the bottom of the curve, I think what started with what's going on, everything's changed. All of a sudden we were asked to totally change and adapt the way we lived and the way we worked without any choice. This was taken out of our control, and everyone has stepped up and adapted, and it's quite phenomenal seeing how businesses have responded to this. But we can't forget that was a shock for people, and people will be carrying that shock through for a period to come. But maybe we think about this as a positive as well. We can see, that people who maybe wanted to work from home previously, where organisations said this wasn't feasible or functional with the type of work we do, actually now they can, and they can see how they can adapt their working practices. But then we mustn't forget that for lots of people, they are now working alongside their small children who are being schooled, they're working alongside family members. So how does the outputs get done when we have these other responsibilities? So I think workplaces need to recalibrate thinking about things from a time perspective, i.e. you sign on from 9 to 5, and thinking more from a what do you need to achieve today? What do we need you to help us with to keep our business running? Then, as I said down below, maybe people are going through loneliness. We have a loneliness epidemic before this even started. So how are we maintaining social connections? How are we helping people to feel integrated and connected? And then we mustn't forget at the bottom that we will be experiencing loss during this period. Whatever that loss may be, it may be tangible loss of family, friends, colleagues. So it's also thinking about how we respond to that. But then, as we go up through the curve, people may be scared about losing their jobs. So how are you communicating what your plans are? There's lots of organisations who are really focusing on the mental health and wellbeing aspect, which is really, really essential. But they're sort of forgetting to communicate what we are doing as a business and the business wellbeing aspects. And then as we move along the curve, maybe we can think about some of the benefits that we've had, as I said, enjoying those team contacts. The social hierarchies or business hierarchies are really flattened in this climate, and that's a really good thing. That's a really positive thing, especially when we think about employee voice. And then we move forward to then thinking about when we go back to work and how you then readjust those relationships, given the fact that we started to see maybe our bosses, the background, how our boss lives, the fact that they maybe have children, dogs, whatever it is we didn't know about them before. We've suddenly opened up those barriers. So what's really important though is who we have in our workplace and how we can spot the signs that that person may be struggling. And what I've done here is just given you some information in terms of the mental health continuum. So we have James over in the left. James has a mental health condition. James has PTSD, so post-traumatic stress disorder. So a traumatic incident happened to James which gave him a period of anxiety. But James has good mental well-being. On the right of James, we have Jane. Jane is one of those people. She's always ready to help. She's always active and engaged in the workplace. Maybe she signed up as an NHS volunteer. She's helping her elderly relatives. She's helping her neighbours. But what happens to Jane in this time? Does Jane actually start to overextend herself? Does she start to take on more? How can you spot the signs that maybe Jane, who's normally a pretty resilient worker, is starting to struggle? And then if we move around the curve and we look at Lisa, Lisa sometimes finds it too much pressure can affect Lisa. So how is Lisa coping? What would we know? Would we see that Lisa would be maybe a bit grumpy when you have your team meetings? Maybe she withdraws, maybe she doesn't attend them, maybe she's quite challenging to management. What are the signs that maybe Lisa is struggling? And then we move round to Declan. Maybe Declan has depression. He has a diagnosis. He's not well. He's been off sick in the past. Is there a reasonable adjustment that was put in place for Declan that may not be relevant now? Have you had discussions with Declan on how he's keeping himself well? And again, in terms of the signs and symptoms of some of these conditions, anxiety, depression, and more complex conditions, I put some links here for you to find some information on these. But what we really need to think about is how are we engaging with our workers? Who is in our workplace? What are the signs and symptoms they had before? And how can we recognise when they may be moving along this continuum, either down to more poorer mental well-being or where their mental health condition is becoming more significant? So how do we do that? And there's been lots and lots of guidance and advice out there about staying in touch. And these are just some pointers for you to think about in addition to ones you may know already. So it's about that blend of one-to-one, team and social meetings, how you actually adjust all of those, using video calls wherever possible, seeing people's faces, seeing the whites of their eyes has such a positive impact on our well-being. It really can't be undermined. And although some people may be uncomfortable with video calling, I'd really encourage that to be considered as far as possible. Ask your staff, what are they doing to keep themselves well? As we said, this is a collective responsibility. And don't be afraid to express your concern. Stick to what you've noticed, that you've observed, you've seen. What are the patterns? Not as in just a speculation. And then think about the questions, think about confidentiality, what those boundaries are, and then about your reasonable adjustments if somebody has a diagnosis, and then think about resources like your wellness action plans. And then drawing upon your range of resources. So some of these you may have in place already, some of these may be new, some of these you may want to consider. I was working with an employer who had a whole strategy ready to go, they just hadn't signed it off. And now they're working at pace to think about which parts do they really want to address, what are the priority areas to really push forward now, and then what are the things that can wait to when businesses start to come back to normal. And then finally, some more delicate issues, some things that maybe hadn't been on your radar before, but maybe now need to be on your radar as HR professionals and as leaders. So thinking about domestic abuse, there has been lots of publicity about the increase in this, the calls, but actually what we notice that only 5% of employers currently have a specific policy or guideline. So think about your policy, and this may increase disclosure if you do introduce guidance around this. Raise awareness of what to look out for, and make sure you have some key staff who are trained in providing signposting, so somewhere that people can go. Don't leave everything up to the line manager. The line manager is going to have a lot on their plate, so think about other resources in your organisation. And again, I put down some links and resources. The Home Office guidance has got such a fantastic range of links for you to consolidate in terms of your organisational needs. Secondly, another issue is about financial well-being. this is a massive issue that's going to have short and long-term impacts for people. So be transparent about the financial changes to your business. Think about your EAP. Does that have any financial advice? And again, communicate external links and resources. There's often a lot of shame around having financial difficulties. So accept that people may not come to you as an employer, as a manager, but they may want to find other resources that they can access. And some organisations are thinking about ways of doing short-term loans to people to help tide them over this process. And then finally, illness and bereavement. As I mentioned before, it is possible this is something that we will have to face, all of us in the organisation, regardless of our role or function. So think about your policies, your special leave policies, your attendance policies, are they clear and up to date? Make sure when you talk to staff about this that you'll stick to just very basic information with them. People will be in shock. So think about how you repeat that information to them, because they may not take it all in on the first time. And again, I put some links there for you. And then very finally, just thinking about those self-care, about how we manage our mental health and how we look after our social health and how we look after our physical health, all are absolutely key to getting us through this and to keeping ourselves well, to work well and to feel well. Thank you.